As COVID-19 vaccine rollouts continue, some people remain skeptical because of misinformation. Our partners at the BBC News share the stories of doctors in the UK who are spreading confidence in the inoculation.
Hello, hi, come on in. My name is Dr. Nighat Arif. I'm a GP in Buckinghamshire. You might have seen me on BBC Breakfast. I'm one of the resident doctors. I'm today here in Cheshire in one of our vaccination hubs, and we're going to try and get as many people through the doors as possible. Are there any questions that you would like to ask me?
Well, I've got penicillin allergy.
We've been vaccinating people at our community hub for weeks now. This is safe for anyone that's allergic to penicillin or any other medications. You will not get a reaction from this at all.
I have faith in you.
Oh, thank you. But there still is some hesitancy out there, some doubts, some questions, uncertainties. Well done.
It's perfect. You don't feel anything.
Thank you so much. So when I got my vaccination done, I really wanted to let my community know that it is safe. So I made some videos in my mother tongue and posted them online. डॉक्टर निगहत आरिफ है और मैं एक NHS GP हूँ पिछले 10 साल लिए। आज मैं आपको मेरे साथ लेके जा रही हूँ। मेरा COVID-19 की vaccination आज मैं करा रही हूँ। Some of the comments left on my videos are absolutely awful. This will cause infertility. That is absolutely not true. This vaccine is haram. This vaccine is not haram. It's been approved by all faith leaders from all communities. You're a sheep, and so therefore you're being brainwashed by the NHS. Nobody's brainwashing anybody. Hi Emma, how are you?
I'm
so
good.
Lovely to see you. Thank you so much for setting up this hub. So I know that we've had real difficulties trying to get some of the members of our community vaccinated, particularly our Asian community. Have you come across that, setting up this local hub?
A lot of the misinformation that's coming out is through things like social media, and I think what's happening is a lot of the younger generation are influencing their parents. We've had cases where parents were initially happy to come in, had a chat with their kids, and their kids kind of said, oh, I'm not so sure.
Hi Sophia, thank you so much. Good afternoon, how are you?
I'm good, thank you.
So Sophia, you were quite hesitant about having the COVID-19 vaccine. Can you tell me a little bit more about that?
I just put 2 and 2 together, and sadly, there's a lot of conspiracy theories, and there's a lot of injustice in regards to the facts that get spread around, and it's kind of hard at times, and you do get sucked into it. And I was so focused on looking at it from one angle, and I didn't even realize that there were other multiple facets to the story.
If you have ongoing concerns, it's okay. Please, please turn to the leaders of your community. Please turn to your GP. Listen to healthcare advice from the mainstream rather than the extremes of social media. Oh, ladies, I'm in awe of you guys, and obviously meet my other BBC Breakfast girlies. I mean, this is awesome. But it's not just me dealing with the questions.
We've had people who've, questioned, how quickly did this get done? Is it safe? Are they going to, genetically alter me by giving me this vaccine? I think we've had a whole lot of questions, and they've been coming actually for a while now.
What are your sort of on-the-ground experiences, Rosemary?
3 cleaners came into the surgery, all Afro-Caribbean, and we said, look, you work in the surgery, we've got these left over, would you like them? And they all refused. They all said, no, we don't trust it, we don't think it'll work for us. And what's so sad is that many of them are more at risk as well. So, it's doubly important that we somehow get them in and get them to trust the vaccine.
The vaccine is the only way we're going to get on top of the virus and get our lives back to normal. Are you okay with needles, or are you worried about needles? We can't let even more lives be lost through misinformation, lies and myths.